Hi, good evening. Austin Mayor Steve Adler. We're going to go through some numbers here pretty quick tonight. Numbers generally looking good, still headed down. Still a little bit cautious about spring break. Still need people to mask, but we're headed in the right direction. Vaccinations are helping. Masking are helping. Let's keep it up. Let's begin with looking at the numbers. We're going to begin by taking a peek at the key factors that Dr. Escott looks at for staging. And here they are. You can see new admissions at 17. It was 16 yesterday, but still below the 7-day moving average. Yesterday, that 7-day moving average was at 20. It's dropped down to 19. That gets us into the yellow zone. We'll take a look at that chart in a little bit greater detail in just a moment. Number of new cases today, 106. That's a good sign. Remember, yesterday they went up to 186 on Monday. And that concerned me because it was substantially higher than the 7-day moving average, which has stayed almost the same. It was 132 yesterday. It's 131 today. But down to 106, that's a good sign because as new cases, if those numbers start going up, that usually means that we're headed to a place where we're going to increase hospitalizations and the like. But so far here, the numbers are looking pretty good. We'll go back now and then look at the other dashboard. This is the one that tells us how many people are in our hospitals and the like. You can see this chart. Austin, Travis County, number of people in the hospital, 173. 7-day moving average, 190. So we're below that. ICU census, 61. That's below the 7-day moving average of 65. Ventilators at 39. One below the 7-day moving average of 40. Number of new cases, 77,000. Haven't gotten to 80. That'd be the next big benchmark. But do need to point out that in the last 24 hours, the number of people that passed away up by 8 people. We went from 780 to 788. I really want us to keep this number, well below 1,000. We ought to be able to do that. I was hoping to stay below 80,000 new cases. Let's see if we can do that. But generally speaking, the number is looking good. Number of cases looking good. People in the hospital is looking good. University of Texas was looking at some of those numbers that were going up, redid its dashboard. So I want to take a look at that. Remember the last time that had been updated was on the 10th. We looked at that yesterday. They've now upped that the modeling. It's not up to today. But you can see that it is good as of March 12th. So we're talking about as of the data just at the end of last week. We were seeing some total number of cases going back up. That's why Dr. Escott hesitated a little bit before he took us down to stage 3. But you can see that the R factor up to 0.88. When we looked at that, with the model 3 or 4 days before that, it was down in 0.6 range. What that means is that the future predictability flattens out a little bit. That's the plateauing that Dr. Escott was talking about. This is looking at the hospital admissions, the one that we set our factors on. We need to get below 10 in order to be able to really get to the next stage. And you can see what this is showing is that we're averaging on our 7-day average right now 19, and this has us bouncing around in 19 to 20, staying at 19 for a while, 17, 16, but into April 13th before we get to we're at 17. In order for us to get to the next stage, we need to get down below that. But hopefully we can do that, get down to the blue stage. Number of hospitalizations, number of ICUs. Remember, 200 was the number we got to that we wanted to stay below. And right now we're down to a number that is for our ICUs down at 61. The numbers are looking good for us being able to get even better as we go in the future. This is the R factor number graphed over time. You can see that recently we were down at the 0.6 place and now up at the 0.89 place. So the number is a little bit higher. You can see plateauing. We have to wear masks. We have to get more people getting the vaccine. But that's the data for us today. Vaccines. A lot of people wanted Austin Public Health to really work on their platform, make the queuing better, make it so you can schedule appointments a couple weeks in advance. It looks as if the predictability of the vaccine may very well get us to the place where we can do that. Austin Public Health tech people working really hard to be able to lay out for you last night a platform that would be substantial improvement, and it crashed. So obviously those folks that thought that yesterday they'd be showing you something that would be really, really impressive have been working with the vendor today to figure out where the glitch was in the programming. There's a notice that's published right now. If you were to go to that website, it says that after working with our vendor throughout the day, March 16th, they have identified the issue that occurred during scheduling last night. They came from a new program code. That's the code I'm talking about, where we're making it substantially better for user experience. Austin Public Health goes on to say, we will continue to test the system to have a successful first dose appointment release on Thursday evening, March 18th. So rather than just the one time to do it on Monday, on Thursday night, they're going to open it up again for people to sign up. They've also determined that they're unable to see who it was that were in the queue on Monday last night before the system crashed, because they don't maintain as a third-party system that doesn't collect the user data. Austin Public Health recognizes that and understands that this is frustrating. We are working, Austin Public Health says, to proactively schedule those who made it past the waiting room and were unable to confirm their appointments due to the technical issues, which means Austin Public Health staff are working overtime to be calling and emailing people that look like they were able to get into that room so that they can get them appointments and get them set up. If you don't hear something, please go back online on Thursday night. It should be set up to take 1A, 1B, and 1C as they work through that model, I hope. But we recognize that a lot of people were unable to move past the appointment confirmation page and experienced much slower than usual scheduling process. APH got about 2,300 people appointments scheduled. This week, it's their intent to give out about 12,000 second doses, about 12,000 first doses, for a total number of 24,000 doses this week. They should be reaching out to you to schedule your second appointment. If you have had 40 days and you haven't gotten notice of that, they tell you just go show up at testing location, bring your card with you to show that, and they'll make sure that you get that second dose. Remember, we get second doses for people, so it's not like your second dose can disappear out from underneath you. But they're working with the vendor. They're going to fix the issues. Sounds like they may have already done that today. They're going to be testing it tomorrow on Wednesday so that they can launch it. They're reaching out individually to schedule people that made it past the waiting room. They continue to schedule people through the Equity Line, which is a phone bank, making sure that people who are unable to effectively compete online have equal access and opportunity to getting a vaccine. In the meantime, it's suggested that you check out other sites too to get scheduled. It's free to get the vaccine wherever you get it from. And most of the vaccines that are coming into our area are not going to the public health. That's a decision by the federal government and the state. But here's a website that you can go to help find places to get vaccines. This is centraltxvaccs.org. centraltxvaccs.org/hubs.php. In order to be able to get out the, let me see if I can get that off. There you are. The 24,000 doses this week. They're going to be testing out some other locations. They're going to be testing drive-through at Burger Center and other places. So that when and if we start getting greater supply, we have more locations, more drive-through opportunities, greater capacity to get even greater number of doses into people's arms as quickly as we can. Just a reminder, closing here, that South by Southwest started today, goes through Saturday, I think. Please make sure that you register. If that's something that interests you, you get to listen to some world-renowned speakers. I was looking at some of the panels, look pretty good. One on civil rights, some on emerging tech industry, its impact on cities like Austin, navigating the entertainment landscape, much more. A lot of incredible films to watch, music to listen to, networking events to participate in as well. If you haven't done so and you're interested, southbysouthwest.com, real simple. SXSW, southbysouthwest.com will get you there. And finally, hey, tomorrow, St. Patrick's Day. Happy St. Patrick's Day. If you have made it this far without catching the virus, please don't press your luck tomorrow. Stay safe, mask up, ATX, keep social distancing, get vaccinated when you can. With that, wish everybody a good night. You take care and be safe.